It's behind these doors in the CBC Newfoundland and Labrador studio where the three provincial party leaders went head to head on Wednesday night. John Hogan for the Liberal Party, Tony Wakeham for the Progressive Conservatives, and Jim Dinn for the NDP. After 3 weeks of campaigning all over the province, they had an hour and a half to gain voters, and right off the top there were promises and a political punch or two.
We will turn around and increase the basic personal exemption to $15,000.
Taking the PST, the provincial sales tax, on everybody's power bill in this province.
So I find it a little bit disingenuous that this is now a platform. I don't trust that they will follow through on it. They had the chance to back it up, they didn't.
And it didn't take long for some sparks to fly when it came to a long simmering issue between the Liberals and PCs, the Churchill Falls MOU between this province and Quebec.
So how, when, who, and why are we waiting to develop a Gull Island? Why can't we develop it right now? Why can't we say to Quebec, we want a good deal with you that benefits Newfoundlanders and Labradorians, not only on Gull Island, but on Churchill Falls, so we can get the money we deserve now and not wait until 2041, when, by the way, again, there might very well not be a deal on the table, in which case all the assets on Churchill Falls will be stranded for every Newfoundlander and Labradorian for years to come.
We will have a deal. We will build energy. We will build industries in the province of Newfoundland and Labrador. Quebec are dancing in the streets right now, and the press is telling them to keep their voices down because they don't want people to realize how good a deal it is for Quebec and bad for Newfoundland and Labrador.
That proposed deal has been a familiar theme for Liberal leader John Hogan since the election campaign started, and that was no different throughout the debate. For NDP leader Jim Dinn, there seems to be a different focus altogether.
I've got a senior couple who've moved from the center of the city in my district down to Placentia because that's the cheapest place they could find. That the rent move was going from $1,200 where they were, which is difficult, to afford to $1,800 to $2,000. I don't know how many stories I hear this, and not just from people born and bred, but people trying to make a home here. They're paying a mortgage and rent, and they'll never qualify for a mortgage. So let's start by addressing the fact that we need to have the resources here, and that's housing.
And for PC leader Tony Wakeham, the election hinges on another issue.
Better health care, lower taxes, safer communities for all of us. And we've been talking about that since the campaign began. Because the number one issue in this campaign is not the MOU or the secret deal with Quebec, it's actually health care.
But while health care is a major concern for many Newfoundlanders and Labradorians, the responses from all the three party leaders on how to improve the system was simply a rehash of past actions and promises.
We have a plan. We've laid it out in our COSTA platform, a 4-year COSTA platform, about recruiting 1,000 new healthcare workers, about prioritizing recruiting allied health professionals, about expanding the nurse travel locum program province-wide, about creating 20 new seats at medical school, about implementing memberships. How about this? Paid work terms for nursing students, not only nursing students, but also education students and social workers.
However, we have recognized that the amount of money spent on travel nurses over the last number of years, particularly since COVID, when there was the mass exodus of nurses from the system, has gone down drastically. In fact, we've reduced it by about 40% over the last number of years. So we need to continue to working on getting more nurses in the system. I think we've hired over 1,300 nurses in the last couple of years.
You know, I can talk about now, and when you ask me why I'm investing in diagnostics, why I want to put more MRI machines in there. There are people waiting in Newfoundland and Labrador for more than 2 years to have an MRI. That's not acceptable. We have a plan in place to address shortages.
And affordability is a huge issue for many parents across the province. Many of them struggle to return to work after having children. We have told you many stories of parents who are stuck on daycare wait lists that number into the hundreds. And here's what each leader said they would do to create more affordable childcare spaces.
I know the strain it puts on families when one parent can't go to work, which means you're not getting the income that you would expect. You have to stay home with your kids where you could be paying $10 a day to get them in that space. So it was a long road to create those spaces and to reduce those costs. The road is getting better. More children are in $10 a day daycare now than they ever have been, and we could continue to create those openings in those spaces for future families in this province.
We have child care operators who want to expand. We have child care operators who want to open, but they're being hung up by the red tape associated with all of the procedures and everything that they have to go through to get licensed to open up. We need to streamline that process.
But it's about addressing the issues of pay and bringing everyone into, I think, into the public system, standardizing the pay, standardizing benefits, standardizing healthcare.
Now, from children to seniors, Newfoundland and Labrador has the oldest population out of any province in the country. And the three leaders agreed keeping people at home for as long as possible should be the priority.
We need to make sure that our home care workers get the financial security they need, get the wages they need. We want it not to be simply a job, we want it to be a career. And we have to make sure at the same time that when we have enough workers that people are able to take advantage of that. And the supports that people need when their assessments are done, if they need to be reassessed. That's what we ought to be talking about.
And this government has implemented things like the Aging Well at Home grant. It's just $400 a year, and I've pledged to increase that to $800 a year. And the caregiver benefit, which is $400 a month, we've done that, and I've pledged to increase that to $800 a month. That's important money to allow individuals and seniors to stay in their homes and in their communities where they want to go as they age.
We have seniors who've been living on the same income, retirement income, for decades in some cases. They can't afford they can't afford to stay together in long-term care facilities sometimes. But it comes down to making sure that they can afford food. That when you look at a senior's benefit, that's increased by 25%. It's about getting at the source from the get-go, so that we don't have as many people needing to go into long-term care. Shouldn't that be our goal?
You can watch the full debate on CBCNL's YouTube channel, and don't forget, you can have your say in who should lead the province next on October 14th. Henrike Wilhelm, CBC News, St. John's.